Breast cancer, the most frequently diagnosed cancer among women in Kenya, ranks first in terms of new cases and second in terms of deaths among all cancers in Kenya. Early detection through self-examinations and regular mammograms is crucial for effective management. Dr. Karen Babu, an oncoplastic breast surgeon, talks about breast cancer treatment.
Basically, breast cancer is treated in a number of ways. We usually talk about 5 main ways, and these 5 ways are combined. It's hardly ever that you will use only one method to treat breast cancer. We use surgery, and surgery is either when we're doing breast conserving surgery. Breast conserving surgery is when we do removal of the breast lump or the breast area of interest and subject the rest of the breast tissue with radiotherapy. So those two, the lumpectomy and the radiotherapy, will comprise breast conserving surgery. This is in contrast to mastectomy. Mastectomy is when we remove the whole breast tissue, and when we remove the whole breast, we can either offer breast reconstruction or the patient can opt to remain flat.
Other treatments may include chemotherapy, hormone therapy, and immunotherapy. Here, we will take you through total breast removal surgery known as mastectomy. A mastectomy is surgery to remove all breast tissue from a breast. It's most often done to treat breast cancer or to prevent it in individuals with a high risk, and it can be unilateral, meaning on one breast, or bilateral on both breasts. There are different types of mastectomy: simple or total mastectomy, which involves removal of the entire breast, including the nipple, areola, and some skin; modified radical mastectomy, which involves removal of the entire breast, nipple, areola, and skin, along with some lymph nodes in the armpit; skin-sparing mastectomy, that involves removal of the breast tissue while trying to preserve the skin and nipple; nipple-sparing mastectomy, that involves the removal of the breast tissue while trying to preserve the nipple and areola; and skin-reducing mastectomy, that involves the removal of breast tissue and some skin to reduce the size of the breast. But do you really know how mastectomy is done? Have a look. A mastectomy is usually performed under general anesthesia. This means you are in a sleep-like state during the surgery. The surgeon starts by making an incision around your breast. The skin is then lifted up and away, revealing the tissue underneath. The surgeon then begins to carefully cut the breast tissue. When the breast has been completely freed, it is lifted away, exposing the top layer of muscle. The doctor will push the muscle aside, fully exposing the fatty tissues. Within the fat deposit lies lymph nodes, lymph vessels, blood vessels, and nerves. Using great care not to damage the large thoracic nerve, the doctor will remove lymph nodes and surrounding fat. Blood vessels will be tied off, and the doctor will thoroughly examine the surrounding tissues for any other signs of disease. When the surgical team is satisfied they have removed the cancer, they will release the muscles and other tissue. 1 or 2 drainage tubes will be temporarily placed at the site. Then, the incision will be closed with stitches, and finally a sterile bandage will be placed. After surgery, the breast tissue and lymph nodes are sent to a lab for testing. Results from the lab will show whether all the cancer was removed and whether cancer was found in the lymph nodes. Your doctor will explain what the results mean and what the next steps will be in your treatment.
As clinicians, we have a big role to play in curing cancer. For example, for a surgeon, when we are doing an operation for the breast cancer, we know that we absolutely have to get as clear margins. Margins mean that not only do you remove the area of the cancer, you have to remove an area clear of the cancer.
Mastectomy, like other surgeries, presents some risks, which may include bleeding, infection, delayed healing, pain, lymphedema, which is swelling in your arm if you have axillary lymph nodes removed, formation of hard scar tissue at the surgical site, shoulder pain and stiffness, numbness in the chest, numbness under your arm from lymph node removal, buildup of blood in the surgical site called hematoma, and changes in the way your chest or breasts look after surgery. You may choose to have surgery to restore shape to the breast. This procedure is called breast reconstruction. It may be done at the same time as mastectomy or as a second operation later.
Reconstruction should be discussed, and people should be made aware that there are lots and lots of options, so that even if they're going through their treatment, they have that in mind. The breast tissue that we are building from comes from surrounding tissues in the breast. So for example, we might use tissue from the tummy wall, so that's the fat, skin, and the blood vessels around that area, to form a breast-like shape.
According to GlobalCan 2022 data, breast cancer is the most common cancer. Kenya reported 7,243 new cases and 3,398 deaths. Globally, there were 2.3 million women diagnosed and 670,000 deaths reported. The objective of the World Health Organization Global Breast Cancer Initiative is to reduce global breast cancer mortality by 2.5% per year, thereby averting 2.5 million breast cancer deaths globally between 2020 and 2040. Nuru Abdulaziz for Willow Explainer.